I'm Al McFarlane. Welcome to Conversations with Al McFarlane. Glad to be here and glad to have you along as well. Uh, Thanks to KFAI, this is a wonderful format, wonderful place to share, to talk about our community, our values, our challenges, and our opportunities. And I want to thank the people at North Memorial Health today for joining me as guests. Today's program is one that focuses on the asset that this organization is to our community, but also on the challenges that we face given the COVID 19 pandemic. Our objective, from my point of view, is to examine issues like hesitancy, why people in the Black community may be hesitant, and how do we move ourselves past hesitancy towards an embrace of the solution, the vaccination solution, towards embrace of the booster shots for those that can be impacted and supported by that, and towards maintaining a set of personal protocols that help us, pandemic or not, just a better way of being knowledgeable about hygiene and health and practices that will support and lead us to productive, fulfilling lives. So I'm pleased today to have Jessica Kingston. She is North Memorial Health Systems Director of Diversity, Equity, and Inclusion. Her work is focused on strengthening workforce strategies that foster a supportive culture and an environment where customers, and I say community, can achieve their best health. And I'm also interviewing today Dr. Mitul Shah, who's a family medicine physician and the chief medical informatics officer at North Memorial Health. He uses evidence-guided medical recommendations and encourages maximal lifestyle interventions to help customers, and I say community, in meeting their personal health goals. Thank you both for being here. Welcome to Conversations with Al McFarlane. And let me say to those who are joining us via social media, uh, we want you to like and share. If you are watching on Facebook, the McFarlane Media Insight News platforms, thank you for being a part of this. And comment, like, share, and comment. We want to know if we're reaching you, and if we're reaching you, that we're really, really reaching you, that we're engaging you. And if you're joining this program from anywhere around the country through the Facebook page of Black Press USA, same thing. This is about the local and the global. It's about our community wherever we are around the country, around the world. The principles we discuss that affect North Minneapolis affect North Philly, North Atlanta, North San Francisco. They affect North London and North Nairobi. And so that's the idea here. How do we have conversations that get to the essential, to the global, to the universal, and how do we make that local in our experiences here in Twin Cities? Well, let me just throw the question out to both of you, but I'll start with Jessica. Unfortunately, COVID-19 is still on the radar. And what are you all hearing as the top concerns about vaccines that are holding people back from receiving the vaccine? Jessica, you first, and then Dr. Dr. Shah, maybe you'd weigh in on this as well.
Thank you very much, Al, for having us this afternoon. It's wonderful to be a part of your show today. And when we think about the Black community, we first need to begin by acknowledging the understandable mistrust of medicine and healthcare that dates back hundreds of years. There have been countless medical experiments conducted upon Black people that have caused both physical and emotional harm. And we need to acknowledge the Tuskegee syphilis study and forced sterilizations on women. And so it's really not surprising that recent studies are showing that Black people are less hesitant to actually get the COVID-19 vaccine. Here at North Memorial Health, our doctors actually are trained in understanding these important historical considerations. They're committed to listening to everyone's concerns directly, as well as addressing their fears. and really trying to make an effort here to help everyone better understand the important research and recommendations. We, when we know about the vaccine, we know we can do better. Black Americans in particular are getting sick and dying from COVID-19. And recent studies have shown that they're less likely to want to get that vaccine. And we want our Black and Brown community members to have the information and the research so that they can make a better informed decision about getting that vaccine.
Dr. Shaw, jump in. Good afternoon,
Thanks.
first of all. Thank you for being here. And
I
thank
appreciate
you
it.
both for your work for healing our community.
Thanks so much. I appreciate you giving us the time to talk about this. This is a very difficult topic for so many people. And in general, I say that there aren't really any easy choices in life in medicine, for example. So when I discuss information like this with people, I talk about, what are the 4 kinds of choices we can make? I think there are some bad choices we can make. Let's not make those in medicine. But there are good choices. Let's make those, right? And then those are very difficult. Those are things that you generally figure out in retrospect. So in between, we've got not good and not bad. So that example I usually talk about next is, let's talk about wearing seatbelts in cars.
Mm-hmm.
What kind of idea is it to wear a seatbelt? And I would say 98% of the time people will say, well, that's a good idea. And then I'll say back, well, it's actually a not bad idea. It's only a good idea when you live through the car accident because of your seatbelt, or you don't get a ticket from when you get pulled over. Until that moment, it was just a not bad idea. And that's sort of how I think about, vaccines in general. Is it a good idea to get the COVID vaccine? We won't really know until after the fact, right? So in 2024, when you never got COVID and you got a COVID vaccine, can you say that was a good idea? Probably. Or maybe you just avoided it that whole time because you were one of the very few lucky people that dodged COVID, right? So last year, we dodged COVID in our home. My daughter had COVID, and she's a teenager, so has been quarantined from us for a few years now. But when she actually got COVID and we tried to quarantine her, she had a hard time staying away from us. But we didn't get it, so we got lucky. Now, everyone in our family's been vaccinated, and we haven't gotten COVID again. So I'm hoping that this remains a good idea. Right now, I can say it's a not bad idea. It means that I'm able to go places. I don't have to get the COVID swab before I go to a concert, for example. Pretty important to me. So Leon Bridges is coming this weekend. I'm very excited to see him, and I will need to have my vaccine. So there's a lot of activities that you get out of the vaccine. And not being able to do those things, I think, should cause us as much hesitancy as the vaccine itself. Too many ideas, too many words. I'm really good at that. Thank you.
So now I'm glad your family is doing well. I can say that your story mirrors mine. A grandchild of mine came home from a sporting event last season, and apparently her coach had contracted COVID-19, and they sent a note to the parents saying this had happened and please have your child checked. And sure enough, she turned up positive, and so they quarantined her and her brother, who was not, and her mom, who was not. But it disrupted the entire family, obviously. And now I think everybody is protected. I think she's still, the older brother is able to get the shot. She's still younger than the age. But that leads me into the next question. We're kind of in the middle of a back to school season, and obviously COVID-19, for the reasons we've discussed, is on everybody's mind. And so how should we be thinking? What should we be thinking to keep our kids and family members safe, and especially when kids under 12 cannot be vaccinated yet? And then what do you think, doctor, about the likelihood, is what we're hearing on the news, of an approval for vaccines for children from 5 to 11 or 5 to 12? And I can tell you that in my household with our grands, we are just hoping and rooting and can't wait until our grandchildren can be fully vaccinated and that's just one less barrier for us engaging them the way we used to, the way we want to. But what do you think?
Yeah, absolutely. So in terms of going back to school, the best thing that we can get our children to do right now, especially when they can't get vaccinated, is to wear a mask, right? So wearing that mask is so important. It's difficult for people. I don't enjoy climbing stairs in general, but it's even worse when I wear a mask. The nice thing about children is they probably are stronger than me and are able to walk up the stairs without becoming short of breath with the mask. But wearing that mask all the time is very important. Indoors for sure. Outdoors, less risk. Now, if you're going to be standing immediately next to somebody, maybe you want to have a mask in those situations. But again, with the airflow outdoors, it's a little bit safer. So I'm glad that we have required masks in my children's schools. I think that it's dangerous to not be masked indoors at this point. We've seen a lot of school closures and a lot of quarantines in many other areas, many other states. So the masking is the big thing. The next piece, obviously, is hand washing, right? We love our hand washing. I never sing the alphabet when I wash my hands, but I just sit there for longer than everybody else washing. So hand washing is important, and then silly stuff that kids will enjoy, don't pick your nose. As much as I want to make fun of it, don't do it, because great way to get stuff in there. Don't scratch your eyes without having washed them. Another way for COVID to get us. So those are just some of the things, right? So masks and hygiene. Last year, because of masks, because of social distancing, because of hand washing, there was almost no influenza, right? And so we are already coming into influenza season. The flu vaccines are out, and now we're starting to get other respiratory illnesses as well. So again, hand washing, wearing your masks, distancing where you can. In terms of the vaccine approvals, I'm looking forward to it. I have a number of friends who have been vaccinated with their children, but then they've got the other ones that can't get vaccinated. And those are difficult situations. When that will happen, it's a great question. The emergency use authorization, hopefully by the end of the year, maybe at the beginning of next year. I have a number of friends also who have enrolled their children in vaccine studies to try to get those vaccines if they could get them. It's a way for us to try to get back to normalcy. I think I win bingo today because you're on mute, Al.
Thank you. I was going to ask you.
It's called bingo.
Ask you more about the hygiene in the house, and so sort of personalizing this more. Your kids are in school. You and your wife or your family, your household has been. You have been vaccinated, and you kind of follow the protocols, but the child has not yet because he or she's not old enough. And what kind of extra precautions are required then by you, because your child might be among other children who cannot be yet vaccinated and who are at greater risk or exposed? What do you do? Child comes home, everybody masked up in the house. My kids are all gone, so I don't know this, but when my grandkids come over, they have to have their mask on. If they come in my house, we actually hang out in my backyard all summer long, and with me and my wife on our deck, and my daughter and son-in-law and the grandchild out in the yard. And so it's a great way to be together, but we're distant. Even though we're all the adults are vaccinated, we still are keeping our distance. If the kid has to come in the house to use the bathroom, everybody's masking up. Is that the way to do it, or what should we be doing differently?
Yeah, I think it's really difficult, isn't it? To see your family, but not hug them, to see your family at a distance, to see them with masks. But I think that's probably the right thing to do in these situations. And, the right thing is for everybody. And again, we won't know any of this until after the fact, right? So in a year or two, when somebody didn't get infected, you'll think that you made the right decisions. But yeah, I think masking inside is important, right? Even with family, it's difficult. I haven't seen my family, my parents, in a couple of years now. My children have not either. So they've missed 10% of my children's childhood, except through FaceTime, which is maybe better than nothing, but it's just FaceTime. So yeah, masking indoors is a great idea. It's fortunate/unfortunate that we live in the north, where it will get cold soon. And how do we manage it then? Um, I think the best idea is to stay masked around anybody that has not been vaccinated, anybody with high risk exposures, anybody at high risk of getting ill from exposures, right? So our elderly, our chronically ill, mask around them. It's not something that you want to have the feeling that you contributed to anything bad happening.
Jesse, jump in. Jesse Kingston, your thoughts. I think, I think my notes say, uh, are in a multi-generational household. Talk about that. What are you doing? How do you manage in your family to have an order that makes sense?
We've had a lot of conversations about this. I have a great niece who lives with me who recently turned 2 years old. So for a really long time, she couldn't wear a mask. And so how do we handle that? I have my mother who lives nearby and other family members that live nearby. And one of the things, that we did is we made sure that we were sort of keeping in contact of what everyone's activities were and really sort of limiting where people were going so that we formed that community pod so that it was really safe for us to be around each other. But when people are traveling, we will often, when we come back and start seeing them, we'll wear masks in the house around each other or keep sort of that distance just to make sure that they didn't catch COVID. We're doing a lot to make sure that everyone's safe and we keep in conversation and talking about it. But COVID does, unfortunately, has hit our family. Everyone has come out of that disease, with the virus and has survived, thankfully. But we do what we can with the hand washing and the masking. I'm probably the one that is wiping down all the surfaces with the antibacterial wipes. You'll see me around before everyone comes over. Let me make sure everything is safe. I think it was my brother one time came over and wanted to watch TV and he said, "Do you have a wipe? I want to wipe off the remote control real quick and just make sure that it was safe to use." So we do take precautions even within the house as well. And I think those are just some measures that has helped us make sure that we aren't getting COVID or we're not spreading it to one another.
Mhm. So we've had the experience of basically nobody coming in our house, except for, as I mentioned, if the grand is over, has to use the bathroom, uh, in and out kind of and masking up. But nobody's been interacting in the house like we used to. And I can't imagine doing that anymore. And I'm kind of okay with it. I'm also okay with working remotely, doing this interview. I used to do these interviews. You'd be in the studio with me at KFAI, and we'd just be chopping it up, and having a good show. But this works just as well for me. It's actually better. And so I'm getting used to this. One of our viewers, in response to you, Dr. Shaw, said he or she absolutely agreed that face touching has been the hardest habit to break. As you were talking about touching your eyes and picking your nose, I'm thinking internally, guilty, you know. And so you remind me that I got to do better. I got to be thinking about stuff all the time because, So then you mentioned, Jessica, travel and then monitoring and knowing.
Mhm.
And obviously you think travel means to Ohio or to Miami or something like that, but I'm thinking travel to Costco, travel to Sam's Club, travel to the restaurant. How do you negotiate that? How do you negotiate knowing where everybody that you may come in contact with, where they've been and what the risk level is because they went to Costco or they went to, First Avenue for a concert and now, or they went to a protest march, a rally. How do you factor that in to your safety strategy?
Yeah, well, one thing, a lot of us all have hand sanitizers in the car. So I know as soon as I get back in the car, I pump that hand sanitizer, whether I filled up the car with gasoline at Costco, I've been grocery shopping. And when there are times of big spikes, I am one of those people who, and some of my other family members, will wear gloves, and we will discard the gloves right after we come out of the store to try and minimize it. I think we've hit a point also within our family where we said, okay, we've all been grocery shopping. We go to the same places. We've taken the same precautions. We're all wearing masks. We've done the hand sanitizers, and that's not where we've caught COVID. So we feel relatively safe in that perspective. But for someone, if they're not comfortable, there have been people where they come into the house and they will wear a mask. I have also kept wipes in my car. I think Dr. Shaw might laugh at me. I will take that hand sanitizer and wipe it down on the wheel and on everything in case I might have touched it. And hand washing. But we limit also the time that we're shopping. We have a list. What are we going in to buy? We're not necessarily in there for an hour to 2 hours sort of walking around and trying to figure out, do I want this or not? So we do limit some of that time when we're out and about in public. And we do social distance. If someone was at a concert or someplace, we do wear the masks and social distance. I'm trying to think what else I might be missing. But that hand sanitizer for us has really been the lifesaver. My mom bought a case, so everyone has a nice big tub in their car.
What comes to mind, Jesse, and again, one of our viewers raised the question about the difficulty of contact tracing. And when you say the term, you think that contact tracing is what somebody else does. It's what the government does, or the clinic does, or the county does. But what you have described, in effect, is a personalized, family level, like granular family level of contact tracing. When you have a practice of knowing where everybody you come in contact with on a semi-intimate level, household member, family, cousin, relative, neighbor, and you have an idea that you've all committed to knowing each other's routines and exposures, that's what contact tracing is at the micro level. Does that make sense to you?
It does. I actually had taken a course on contact tracing, and I know last year when I got COVID, I was expecting contact tracing to go the way that it was at this particular course, and it didn't. So I was very intentional of, okay, family members, here's who I've been in contact with. Let me, make sure you're in that window, watch your symptoms, keep distance, and having that conversation and being open and honest about it helps to minimize then the spread.
Did you discover or find out how you contracted COVID?
I do. I happen to be working early voting, and that was the only place that I had the most exposure, being around a lot of people. And although was wearing a mask and doing my best to stay safe, this virus looks for a host. And as soon as it can find a host, it's going to go in and it's going to impact you.
You were the lucky one, right?
I was the lucky one. A lot of coughing and sneezing that followed, but fortunately, no one else in the family caught it.
Had you already had your first vaccination, or was it before the vaccines were available?
This was before the vaccines were available. So actually, it was last October when this happened.
Mm-hmm. Okay, well, I'm glad you came through that okay. Yeah. I'm Al McFarlane. This is Conversations with Al McFarlane. I'm talking with Jesse Kingston, right? That's right. And Jessica Kingston is North Memorial Health Systems Director of Diversity, Equity, and Inclusion. She works on strengthening workforce strategies to foster a supportive culture and an environment where customers and I believe community can achieve their best health. And also Dr. Mitul Shah, who's a family medicine physician at North Memorial Health. He's also the Chief Medical Informatics Officer, and he uses evidence-guided medical recommendations to encourage maximal lifestyle interventions to help customers and community meet their personal health goals. Let me unpack that, Dr. Shaw. What does that mean? What is informatics, first of all, and what's the practicality of that mission, that assignment that you've taken on at North Memorial?
Sure. So informatics, it is a field that overly simplify, if it involves electricity and a human, informaticists get in the way of those two. And what I mean by that is, if somebody's computer isn't working, a physician's computer isn't working, frequently the first call is to us. It turns out I don't really know how to fix computers. That's what I use my colleagues in information technology for. But so we do pretty much anything and everything. How do you get your phone to work right? So if I want to access, my electronic medical record on my phone, I play with that. If I want to make it easier for our patients to contact us through the internet, I do that. Scheduling, for example. What are the ways in which we can make technology work for us instead of what some would argue is against us? So in the healthcare field, it's stuff like we just rolled out our COVID booster scheduling. So the FDA and then the FDA subcommittee and then the CDC subcommittee, they had a number of recommendations. So we tried to quickly process all of that into a system that allowed people to just go on the website, click a few buttons. I think we're down to about 5 clicks, and you should be able to schedule your booster vaccine. Similarly, in terms of evidence guidance, we do a lot of things in our personal lives, in our attempts to get healthcare, as well as when we deliver healthcare to providers that are tradition-based. So, for example, the annual physical. We love our annual physical, although there's not a whole lot of science supporting the annual physical. So what I try to do is set the system up such that we get all the right stuff done and the right timelines. So for a long time, we recommended colon cancer screening for African Americans since at age 45. All others were age 50. Earlier this year, that guideline changed to 45 for everybody. So we changed that in the system so that basically you click a button as a physician or provider, and the order is made to help somebody get their colon cancer screened. We also have interfaced all the COVID, everything that we can. So when you see somebody in the clinic, on the side of the screen, they've had COVID or not, they got their vaccine or not, they're due for a vaccine. We will put it everywhere we can because it's that important, right? It's the dashboard light going on to tell us this is meaningful, and then trying to hide everything that's not meaningful.
I would paraphrase that practice by saying it's data-driven decision-making, right? It's collecting and presenting data that allows people to make decisions that are as best informed as they possibly can be at any given time. And the reason I say that is because that we are at Insight News have a project that we call iHeal. iHeal is the Insight Health Equity Action Lab, and the principle is to encourage research and to encourage the creation of data, research-based data that can help our community make better decisions. Data-driven decision-making as a norm and a new standard in the community. And how do you translate that so that it becomes part of the language, the vocabulary of everyday life among ordinary people? So we begin to understand data and understand and appreciate the value of research, and then we become participants and owners of the process of research and evaluation and decision making. And that is important because in history, and you mentioned this, Jesse, we have seen ourselves be passive victims of research. And not that the research hasn't been important and valuable, but there is a question of what is right? What is morally right? What is ethically right? And there's a question of consent, right? And a question of ownership of the data. And our experience has been that we get studied and studied and studied, but never benefit from the study. In fact, the study, this is an McFarlane-ism, we get the misery, they get the money. So our misery becomes a business for somebody else. And that is, in fact, what we have to turn upside down and inside out. And I think that what you're saying, Dr. Shaw, about understanding informatics, about data, and making that awareness of it in the community elevates all of our ability to be our own advocates and partners in maintaining, creating health. Am I on the right track in my thinking? What do you think, Doctor? And Jesse, what do you think?
So I think that's a great way to put it. My way is a little bit less intelligent sounding, which is I do my best to not let my feelings interfere with my thoughts. Mm-hmm. Right. So a lot of what we do, like I say, tradition, like this is what we've always done. This is how I've done it. We need to stop thinking about that. We need to think about what is right. And so when I'm talking to people about making medical decisions, it's all about, what do you think? Now, what do you feel? Like we need to try to cut those two off. Data is the right way. Unfortunately, data doesn't always get us there, though. Right? Mm-hmm. So there's lots of data regarding the safety of vaccines, for example, the consequences of not getting vaccinated, the consequences of disease, and we can't, get past feelings in some situations, and that's when it becomes difficult. So I do my best to lead with data, to lead with evidence, to lead with science, knowing that sometimes, historically things have not gone right. And that's unfortunate.
Well, the principle there is garbage in, garbage out, wrong information, wrong results. But that leads to the next question, and that is, like everybody else, my social media feeds are filled with news articles and opinions on the vaccines. And every day it seems like it's a hot topic or that it changes every day. So where do both of you go for trusted information? And how would you advise, your family members, your friends, people that listen to you, to approach the massive amount of data, much of which is ill-gotten, and much of it has bad intention? How do you advise and help people sift through that and be safe and be their best, informed citizens? Jesse, you first.
I'm fortunate to actually work with several doctors, and that's who I talk to. And when Dr. Shaw is in the office, actually, he's next door to me. And so I can go over next door or talk to some other physicians and talk through some of the stuff that I might be reading, or what about this? And I encourage everyone to speak to their physician to get input and to answer questions. And if they don't have a doctor, certainly call us. We can help get you connected with the physician to talk through your personal health history and talk through your questions around the vaccine in particular to help make that informed choice. And so you can contact us at northmemorial.com, or you can call us at 763-581-2273. But I do, whether it's physicians here at North Memorial or physicians that I trust that have really been at the forefront publicly talking about COVID, those are where I'm listening.
Dr. Shaw?
Thanks. So I think it's great, as Jesse says, talk to your doctor. Doctor in Latin is, it's derivative of to learn or to teach. Right, that's what we should do. In terms of where do I learn so that I can teach, I go to the CDC websites anytime that I have a question. We have a number of clinical reference sites we use because I don't know everything. I don't remember everything. I'm getting old. I forget things. So I'm always looking anywhere that I can find good science-based information. So again, the CDC is great. Our website has links to both the CDC as well as the Minnesota Department of Health. But generally, governmental agencies, despite what some may think, don't have an agenda in this space, right? The goal here is to keep everybody alive in the country and moving forward. So CDC, MDH are great. Up to Date is a website that I use a lot. Dynamed is another one. These are two reference sites for medical professionals as well.
I organized a group here in Minnesota called the Minnesota Multicultural Media Consortium. It consists of owners of Black, Asian, Latino, and Native American media. And together we went to the health marketplace asking our government, among others, and hospitals to use our media to communicate. And we organized back when AIDS was just emerging as a global threat. And we organized in part because there was massive disinformation there. Disinformation was a cultural assault on Black people. There was common language in the reporting that implied, if not said, that Black people were the source of AIDS, right? And so, what does that do to the psyche of a population? It can't be much different from what happens when you have a president calling COVID the China, disease, right? So we've been through this before, and unfortunately, our society has a history of doing this shorthand that has a consequence of marginalizing and supporting the marginalization of entire populations, of entire cultures, demonizing people instead of bringing healing, awareness, and understanding. So, um, you mentioned the sources you use. I'll ask you both: how important is it that institutions like yours have reached out to Insight News, and we thank you for that, to partner with getting quality information to the community? I want to thank you first of all, but how important is that government and institutions engage the information infrastructure of our cultural communities? What do you think, Dr. Shaw?
So yeah, it's speaking people's language. I think that is the most important. So what we as physicians do a really good job of is speaking medical English, which is frequently difficult to understand, right? And I've done my best in my whole career to try to speak the right language.
Mm-hmm.
On a positive note, my level of diction is relatively low, so most people think I've got about an 8th grade education. So I don't think I'm that difficult to understand, but speaking the right words, speaking the right language, transmitting the message in the right channels, right? So where do people get information? How can we get there? That's so important. We're trying and we need to do better. Now, how do we do that? It sounds like you could be a resource for us, Al. Thank you for telling me more about that. I'm new to the state, relatively speaking, and I don't know enough. But yeah, we need to reach people wherever they are. And we need to reach them with, let's say, the truth, the facts, not the feelings, not the interpretations. So your data desires you have to interpret the data for yourself, or rely on experts to help you with that.
And Jessica, this is kind of in your wheelhouse too, because what you are is one of the pioneers in the arena of diversity, equity, and inclusion, and that's a big field. It's a philosophy. It's a way of knowing, and it's not etched in stone yet. It's not like, and so people are bringing their personality and their awareness that is ever evolving to the table of what it means to highlight diversity and equity and inclusion. And it has to do with jobs and purchasing, but it also has to do with education and awareness and connectedness of the community and of the institutions like North Memorial in the community. And so how does the question affect you? Getting to trusted sources, trusted alliances in the community to help you affect the work that you are doing.
We are a part of the community. We are here to help people when they're not at their best health, right? There's a reason why you're typically coming into the hospital or seeing a doctor. It's not usually, I'm coming in because I feel wonderful and I'm not going to get any bad news. And if you have questions or you don't trust us, that's a problem, right? Our goal is to help people achieve their best health. And one of the ways that we do that is to make sure that we are supporting our community and making sure that they have the information that they need to make informed decisions. And we do that in a variety of different ways, which is partnering with media outlets like yours and others to make sure that we're building those relationships so people trust us and they know when they come in the door that all of their dimensions of difference are going to be valued, are going to be welcome, and that they have a sense of belonging, that the information that we're giving them they can trust because we are actually providing culturally responsive care that meets their needs and addresses their fears, concerns in a way that isn't for us, but for every single person that we are interacting with.
Let me shift back to the question of the Pfizer biotech vaccine. Are you guys expecting to see a rise in vaccine rates with the approval of, I guess, the Pfizer, is it BioNTech? Is that the right word for it? You can help me pronounce it properly. What are you expecting with that and with the announcement for boosters?
So unfortunately, I'm not in marketing, so I have no idea how to say BioNTech.
Okay.
But BioNTech sounds good to me because it's almost bionic.
Okay.
So yeah, the FDA approval of the vaccine itself, I think, helped some people get over that hump, right? From it being experimental, right, emergency use authorization to approved. Not everybody's gotten over that hump. The next piece is the booster. That's most important for people at highest risks. So when I try to talk about vaccines in general, I talk about two things. One is what is your risk of exposure? Two, what is your risk of death from disease? And then now I'm looking at what is your risk of giving it to somebody? So we talked about our family coming over, our friends. So what are these three factors? So for folks who are at very high risk of exposure, so for example, you work in a clinic, you work in the emergency department, you work in a grocery store and you have to be in front of people, you're a bank teller, taking money. These are high risks, relatively speaking, right? So your risk of exposure is high. What is your risk of dying from disease? So if you are ill, heart disease, transplant, that sort of thing, that's a high risk. So factoring, and then what is your risk of giving it to people? So the boosters in the healthcare worker community is an interesting one. So, we're protected with our face shields and masks, and we wash our hands a lot. But are we going to give it to somebody? And if I give it to somebody, am I going to give it to 20 people in a day? Right? So my risk of giving it to people is high. So I factor those three things in. So the boosters, I think, are for that specific group. And I look forward to who's the other ones? There's the J&J version and the Modernas, right? So those should be coming up soon. But just based on studies in Israel, it seems that we do need a boost. The vaccines don't last forever. They may help us, prevent death, but they don't prevent disease all the time. So I actually have a close friend who's received both of their vaccines and recently got COVID, a breakthrough case. It happens. They're not feeling great. Now they're not in the hospital, and that's huge, right? And that's what I talk about with all of the vaccines, influenza, everything. It's not to prevent disease, it's to make you not die, and it's to make you deal with it. Just be really sick, not awfully sick.
So can community members get COVID-19 vaccines through North Memorial Health? How does it happen?
Yeah, so right now you are able to get these vaccines if you meet any of the criteria released by the FDA. The FDA and CDC last week. You can book those online through the website. You can also very easily go to any pharmacy. There's many more pharmacy appointments available. Frankly, they are national purchasers. They are national distributors, so their channels of getting vaccines are much larger than most of the clinics. So any and all clinics in the area should be able to deliver these vaccines in some way. Although admittedly, the pharmacies may be much easier to schedule at. But again, our computers made it easy.
Okay. I see in my notes we have a content capsule one. It says, and it's a vaccine education piece that you've done for apparently for Univision. And I don't know if you have that to do a screen share on, or if Andrea is in the back room there and has a screen share. But I'd love to share that to our listeners and viewers. If Andrea is there and has that available and can share the screen, we'd love to play that 90-second spot. I have the script here that you use, but it's a great message, I think, that you're presenting to people in media. And so let's see. I don't know, let me change my view of the chat here. Andrea, if you are able to share a screen. Oh, she says she does not. Okay, that's fine. Well, listen, I often spend time asking my guests their personal stories. So I think personal stories explain the enthusiasm that people bring to these conversations. And you both have brought a marvelous, wonderful, confident uh, confidence in your engagement with me here and with our audience. But tell your personal story, Jessica. How do you come to this work, and what's your vision, your sense of purpose that guides you every day?
I grew up in a really diverse family. I have two older brothers and a younger sister that I grew up with, and we are all adopted. We are not biologically related. We grew up in white middle class America with white parents, but we reflect shades of a rainbow. I have a brother who has lived in a wheelchair his entire life. I have a brother who is Mexican American and a sister who's biracial like myself. And we encountered a lot of issues growing up. And I believe in creating a world and a community where people don't have to experience what we did as a family. And that really has put me on the path of what I'm doing. My family, my several of my parents have all been in the healthcare field, actually in the field of mental health. And while that was not the field that I chose to actually go into, healthcare is something that people rely on and need to get the care that they deserve. And so for me, being here at North is really important to bring sort of that belief of equity and inclusion and that sense of belonging and being valued for who you are into getting your care.
You said several of my parents jumped out at me. Tell me, what do you mean by that? That's a wonderful concept. It's new to me. Talk about that.
Sure. So my first father died of cancer when I was 5, and my mother remarried, and then my parents divorced, and each have remarried since then. So that's why I say several parents. I've had a lot of
That's wonderful.
amazing adult influences in my life that have helped raise me into who I am today.
I never heard that before. That's awesome. That's wonderful. Dr. Shaw, tell me about yourself. What's your story and what brings you to this point of passion as a healer and a leader in informatics?
Yeah, so for me, I realized at some point in my life that as a physician, I can only take care of the people in front of me, right? So maybe in a year I could help 3,000 people, right? And that's a lot, and and it's great. But then what I realized is if I can touch the computers, the tools that all the physicians use, right, that all the patients use, that all this healthcare systems use, could I help even more people? Right. So now I'm down to clinic only 1 day a week. I don't take care of enough people. And I spend a lot of time trying to change the system so that anybody who's trying to get care can deliver it better, can receive it better. And it's my way to try to touch more people. And, this work, I'm so happy that Jesse's joined our organization. This is very personal for me, dating back to childhood. My parents are immigrants from India. Growing up in the 70s, as you may recall, it was a different time. And, I think the time has come for us to maybe not live in the 70s anymore, right? We have to address these differences. We need to meet people where they are. We need to stop doing things the way that we've always done them. And, the best thing about computers is it removes the emotion from me. Because, again, I'm not so good at the feelings. And if I can just use the computers to do everything, it makes it easier for me to to try to improve everything that we do.
Were you born here or born in India?
Yeah, so I was born in New Jersey, and grew up mostly in Chicagoland. And it's, so most of my life I've never been identified as an Indian. So, Jesse, for example, is biracial. I've been identified as most every other ethnic group there is, just depending on, who's around. My best friend's growing up a black guy and a Colombian guy, right? So we heard all the stories, and let's just say we dealt with some of the issues growing up as a non-majority person in this country.
Okay, listen, I thank you both for being here, and thank you both for sharing your stories and your passion. I want to take the last couple of minutes to sort of reflect again on North Memorial, and I want to say that I want to give credit to North Memorial for being a leading voice and a leading provider for standing, I think, strong and aggressively in its commitment to providing quality service, empathetic service, a listening ear, and a willingness to hear and to see differently. And I think that's the path of the future. I think you might have been saying that, Jesse, that it's about listening, really, listening and not simply prescribing or pontificating. Healing is something that we do together. And so I want to take the last minute or so to ask you both to reflect on that mission, that element of the work of the institution that you're connected with and the institution's role in community. So I'll start with you, Dr. Shaw, and then Jesse, think about it. And what would you say about, again, the institutional character of North Memorial in our community? Dr. Shaw?
So I actually came to North because of its mission, because of with whom they work, where they work. I work in Camden. It's very meaningful to me to be able to do this work, and that we're investing the time, in this space. It's amazing from my perspective. It's difficult work, and let's just say healthcare hasn't done the best job over the years of doing the right thing by everybody. But it's of huge importance to me, and the organization has been very supportive of all of this, right? I mean, we are dedicating so much time to trying to do a better job, and there's always room for improvement. There's always more work to do, but, I'm lucky to be a part of this.
Thank you, Dr. Shaw. Jesse Kingston?
I always think about our mission and our vision, right? That we are here to help our customers achieve their best health. And we do that together the way that healthcare ought to be. And healthcare ought to be this way that reflects our community and engages in our community and brings everyone together. And to have that focus on the community, being here where we are, is so important. We are a diverse community, and if we are not meeting our needs and we're only catering to one group, we won't achieve everyone's best health. But that focus and that intentionality is why I am here at North.
Listen, thank you both so very much. I'm Al McFarlane. This is Conversations with Al McFarlane. We're here every Tuesday live on KFAI, but we actually are doing the podcast every day at 1 o'clock. And you can check us out at Facebook Live or on YouTube. We're just growing a YouTube channel. We appreciate you checking us out on YouTube, liking, subscribing, and sharing, letting people know that we're here. Let us know that you're here as well. With that, again, I want to thank you both. Thanks to North Memorial, and keep up the good work. I'm Al McFarlane, and we'll see you next time. Take care.
Oh, Queen Justice, where are you? Did they beat you up or no? Lock you on the ground, take the crown away from you?
Oh, Lady Liberty, red, white, and blue. Did they take your dignity with their bigotry? Teach you that you're born to lose.
Free or guilty, it's gonna get filthy. Better believe, roll up your sleeves. It's gonna get rough, it's gonna be tough. We Going back in time won't make America great. We need justice now, people won't wait.
Action, no more distraction. Every step we take, we gain traction. If it can happen to one, it can happen to all. United we stand, divided we fall. Free or guilty, it's gonna get filthy. Better believe, roll up your sleeves. It's gonna get rough, it's gonna be tough. We all agree, we've had enough. We've had enough
of all the rules you were breaking.
We had enough
of all the money you were making.
We had enough.
No more life gets taken.
We had enough.
This is a proclamation.
Free or guilty, it's gonna get filthy. You better believe, just roll up your sleeves. It's gonna get rough, it's gonna be tough. We all agree, we've had enough. We've had enough
of all the rules you're breaking.
We had enough.
All the money you're making.
We've had enough.
No more life gets taken.
We've had enough.
This is the proclamation.
We've had enough. Trayvon Martin and Tommy Rice. We've had enough. Michael Brown and Eric gonna pay the price. We've had enough. Philando, Breonna, George Floyd. What? We've had enough. So many gone. How can we fill the void?
How can we feel?
We had enough. John Crawford, I know you've heard. We've had enough. Sandra Bland, come on and take a stand. We've had enough. Sean Bell, what the hell? We've had enough. Freddie Gray, did you hear what I said? We've had enough.
This is a proclamation.